With all the debate that's going on about healthcare these days, I think it's important to understand exactly what we've been asking for and exactly what we're going to be getting when all is said and done. I'd like to start with making a few simple definitions because the healthcare industry has done a really good job of blurring the lines between the definition of certain words. It's important that we understand exactly what we're talking about. 1. Healthcare. The services provided to you by your doctor or your hospital. 2. Health insurance. One possible way to pay for your health care. 3. Single payer plan. The government becomes your insurer, not a private company. Now, what we've asked for, insurance companies have gotten way out of hand, overcharging for the services, denying coverage every chance they get in an attempt to minimize expenses. You see, if you want to make a profit, you have to take in more money than you spend. That is the single biggest problem with the health insurance industry in America today, is the profit motive. Now remember our definitions. Health insurance is only one possible way to pay for your health care. Now, opponents of a single payer plan have said, we've already got a great healthcare system here in America. Why would you want to change that? And in a way, they're right. We have great doctors. We have wonderful research facilities, great hospitals. It's not the health care system that's broken here. It's the method of payment. If you can't afford to be in one of those hospitals, it may as well not even be there for you. Right now, insurance companies have a cash cow, and they don't want to let it go. So when all the debate started about health care, they got their lobbyists to work full time. At this point, I think it's necessary to give you yet another definition. Political will. What political will means is the lobbyists who finance my campaign don't want me to give you a single-payer plan, so I'm going to tell you that I'm on your side. And I'm going to tell you that I'd really like to give this to you, but we just don't have the political will in Washington to do it. Well, for anybody who's been taken in by that argument, that's kind of like allowing yourself to be raped in the hopes that later you can negotiate a better relationship with your rapist. So what are we getting? What is the compromise? Well, the Obama plan isn't so different from Mitt Romney's plan. This is Obama/Romney Care, with a few tweaks and a public option that even now, as I speak, is being stripped from the bill. This has already been implemented in Massachusetts. I'm living with it already, and I'd like to share with you exactly how it works. First, it's not a single-payer plan. The government provides you nothing. You still have to buy insurance from the same companies that have been screwing you over all along. Now, in order to understand fully where I have a problem with Obama/Romney Care, I think I need to give you yet a couple more definitions. Racketeering. Any act or threat involving murder, kidnapping, gambling, arson, robbery, bribery, and extortion. The relevant one here. Extortion. Most states define extortion as the gaining of property or money by any kind of force or threat of violence, property damage, harm to reputation, or unfavorable government action. Now let's take a look at the Massachusetts law. Mandating coverage for all. A key assumption behind Chapter 58 is that the continuation of a voluntary health insurance system will never get Massachusetts to the goal of near universal coverage. Therefore, the law creates a first-in-the-nation individual mandate. It requires residents over 18 to obtain health coverage or face financial penalties. Unfavorable government action, i.e. fines. This is extortion. Notice they're not talking about health care here. They're talking about health insurance, which is only one possible way to pay for the health care. So let's see what the penalties are. The Massachusetts Department of Revenue, the IRS, is responsible for enforcing the individual mandate through the state income tax. Failure to obtain insurance will result in a fine for each month the individual does not have coverage. The fine will be not more than 50% of the premium for the least costly available insurance. So if I come to your home and say, buy my fire insurance or I'll burn your house down, I'm a racketeer and an extortionist. But they come to my home and they tell me, buy this health insurance or you'll have to pay a fine. This is not health care. This is not insurance. It's racketeering. So let's look at the cheapest extortion plan available. $587 per month, $2,000 deductible. You pay this much before the coverage even begins. Hospital stay, 20% co-insurance. That means they only cover 80%. So if my hospital stay is $100,000, I have to pay $20,000 plus my $2,000 deductible for a total of $22,000. Now I live week to week. One heart attack and I'd be bankrupt. And for this wonderful service, I need to pay $7,044 per year. And if I choose not to buy it, I'm fined $3,522 per year. Oh, and by the way, in the time it took me to script this video, the cheapest plan went from $587 per month to $695 per month. So much for holding down costs. And the companies still try to weasel out of their responsibilities. Recently, my daughter sprained her ankle running home from a friend's house. And Tufts Healthcare sent me this letter. I'd like to read that to you right now. We need to obtain detailed information concerning this claim, which may be related to an accident, and therefore may be the responsibility of another organization, person, or insurer. Wow. You know, sprained ankles and broken arms usually are the result of accidents. That's what we buy insurance for, isn't it? They didn't fix anything. I'm forced to buy a faulty product from a list of companies that have a state-provided monopoly. And I'm sure there's some kickbacks involved in getting on that list. We asked them to get these companies off our backs. Instead, they put a gun to our heads and told us, do business with them, their way, or else. Now, I don't have the financial means to fight this. All I have is this video. Anybody who wants to mirror it, more than welcome to. We're being robbed here, and if I'm going to be robbed, you're going to have to do it in front of the public. Because everything you guys do to me, every bill I have to pay, every deductible I have to pay, every fine I have to pay is going to be posted up here on YouTube for the world to see. Welcome to YouTube, Tufts.
Is this the best we can do? Mandating private insurance, forcing people to buy private insurance policies or pay a penalty, guaranteeing at least $50 billion in new business for the insurance companies? Is this the best we can do? Government negotiates rates which will drive up insurance costs, but the government won't negotiate with the pharmaceutical companies, which will drive up pharmaceutical costs. Is this the best we can do? Only 3% of Americans will go to a new public plan. Well, currently 33% of Americans are either uninsured or underinsured. Is this the best we can do, eliminating the state single-payer option while forcing most people to have to buy private insurance? If this is the best we can do, then our best isn't good enough, and we have to ask some hard questions about our political system, such as health care or insurance care, government of the people or government by the corporations.